Good evening, all. Today we are just discussing few scales in psychiatry. That would be a part one, and we might release a part two later. So, why there is a need for these scales? Mainly to assess the symptoms, to assess the progress after the treatment, and also to know the severity. And many a times the questions which are asked are: what is the minimum scoring? What is the maximum scoring? What are the cutoff scores? Any special things about the scales? So let's discuss few scales. You would be discussing the scales, but it is advisable to read about those scales and make your own notes from the actual articles. That is just to give you a brief and for little fast revision. Let's start. First scale, let's see, that is BPRS, brief psychiatry rating skills. Total items can be 18 to 24, and the minimum score for one item is 1, maximum score for one item is 7. So you can easily multiply to get the maximum and the minimum score. If it is 18, just multiply by 18 into 7. That will give you the maximum score if there are 18 items in the scale. Cutoffs are not there. Mainly, it can be used for all the psychiatric illnesses to see the severity and the improvement in the follow-ups. Is 0 possible in that? So, no, 0 is not possible. 0 will not be possible in this scale. CGI, I'm not taking it. Say a few scales like SANS, SAPS, and PANSS. SANS, SAPS, both were given by Nancy Anderson. So let's see SANS. It consists of 30 items, and for one item, the minimum score is 0, maximum score is 5. So that is a 6-point Likert scale. Means 0 to 6 are the 0 to 5. So 6 points are there. So SANS, and representing by the 5 scales of health domains, that has affective flattening, blunting, affective flattening or blunting, alogia, evolution, apathy, anhedonia, asociality. So SANS helps the clinician to track the treatment progress. Each subgroup contains different number of items. So according to that, the total score for the different domain will vary. Same as like for the SAPS, we see 34 items are there. There were 30 in SANS, now 34 in SAPS. Scoring is would be same, 0 to 5 for one item. There is nothing for the cutoff. 4 domains which are there are hallucinations, 7 points are there, delusions, 13 points, bizarre behavior, 5 points, positive formal thought disorder, 9 points. It helps the clinician to track the treatment progress again, and each subgroup contain different number of items. And again, I would like to mention that both SANS and SAPS were developed by Nancy Anderson. Again, it's a 6-point Likert scale. Then we take YMRS, Young's Mania Rating Scale. So 11 items are there. Minimum score can be 0, maximum can be 60. So here coming the cutoffs. So more than 13 can be hypomania, more than 20 mania, more than 30 is severe mania. So one catch which is mostly asked in that is 7 items are scored from 0 to 4, but 4 items are there which are scored like 0, 2, 4, 6, 8. Just keep in the mind that there is no 3, 5, 7 or 1 over here. So they are scored on 0, 2, 4, 6, 8, and because that can be evaluated even if the patient is not cooperative. And those, what are those 4 items? Those are irritability, speech, content, disruptive, and aggressive behavior. 0 possible? Yes, 0 is possible in that. So wherever you will see that the minimum score, minimum score of one item can be 0, then 0 will be possible. It was not possible in PANSS. I think we forgot to mention PANSS. PANSS consists of 30 items. Minimum score 1 for one item, maximum for 7 for one item. So for 30 items, maximum score would be 210. That is a 30 item scale. So 7 positive symptoms, 7 negative symptoms, and 16 general psychopathology. Widely used to assess the response to a antipsychotic. 0 is not possible. Let's see MADRS. So 10 items are there, minimum 0, maximum 60. These are the cutoffs: 0 to 6, no symptoms, 7 to 19, mild depression, 20 to 34, moderate depression, more than 34, severe depression. Items are scored on a scale of 0 to 6. 0 possible? Yes, 0 is possible. Let's see HAM-D. 17 to 21 items, observer rating scale HAM-D. 0 is the minimum, and 52 or 53 can vary for the 17 item scale. The reason being because the item number 16 has a weight loss which two different scoring. One is A, one is B. So for A it is 2 when the exact weight loss is not known. When exact weight loss is not known, for B it has up to 3. Cutoffs: 18 to 16 is mild depression, 70 to 20 is moderate depression, more than 24 is severe depression, and less than 7 is remission. BDI, BEX depression inventory, 21 items, minimum score 0, maximum 62, cutoffs are 0 to 9 asymptomatic, 10 to 18 mild to moderate depression, 19 to 29 is moderate to severe depression, more than 30 is severe depression, 0 possible, yes. Now see, YBOCS for OCD, there are 10 items. So minimum score can be 0, maximum can be 40, because you are taking up to the 10 items. And the full scale, there would be 19 items, but we are counting up, taking the numbers up to the 10. So cutoffs would be under 7, likely to be subclinical, 18 to 15, likely to have a mild case, 16 to 23, moderate case of OCD, 24 to 31, severe case of OCD, 32 to 40, extreme case of OCD. So items are rated from 0 to 4, and in obsession and compulsion, both we have time interference, distance, resistant control. I used to have this mnemonic, TIDRC. Again, we will mention 11 to 19 items are also there, but we are not taking generally for the scoring. 11 is insight, 12 is avoidance, 13 is degree of indecisiveness, 14 overvalued sense of responsibility, 15 pervasive slowness, 16 pathological doubting, 17 global severity, and 18 global improvement, 19 is reliability. 0 possible, yes. Rest of the scales are there, like for anxiety, MA, SARAD, for ASD, incline ISAA, CARS, for ADSD, for substance use audit and cage opioid cow, COWS, nicotine trigostome, for dementia, MMSC, HMSC, eating disorder, E26. So we may take it later. Thank you.